Pinaka-karaniwang po ang Breast Cancer Awareness Month tuwing Oktubre. Isang paalala sa lahat, lalong-lalo na sa mga kababaihan na makapagliligtas ng buhay ang maagang pagtuklas nito.
Yes, Mommy Dims, at ayon sa Philippine Statistics Authority o PSA, 3 sa 100 Pilipino ang mayroong breast cancer at ito rin ang pinakakaraniwang uri ng cancer sa mga babae. Pag-usapan pa natin yan, kasama natin ang internal medicine specialist at medical oncologist na si Dr. Arthur Jason Go. Good morning, Doc Arthur. Welcome back.
Good morning, Doc Arthur. Thank you for being here. And thank you. We are both wearing pink today, Doc.
Ako lang ang hindi
okay lang
naka-pink.
yung cheeks mo naman pink
Ay.
palagi. Okay. Ito, Doc, pag-usapan natin. Para sa mga kapatid natin na maaaring may alam na ng konti dito or para sa mga kapatid natin na walang kaalam-alam pagdating sa breast cancer. Ano nga po ba ang breast cancer?
Okay, so breast cancer comes from a abnormal cell na nandun siya nag-start sa ducts gland ng breast, no, kung saan lumalabas yung gatas ng isang ina. So it goes abnormally, no, exponentially ang laki nun. And then nangyayari, nag-invade siya, no, kumakalat siya to the lymphatics hanggang sa pwede siya kumalat sa lungs, sa bones, sa brain, sa liver, ganun siya. That's why it's really aggressive in a sense.
Sobrang common talaga nito, Doc, no? Pero bukod, Doc, sa bukol sa dibdib, ano pa nga ba yung ibang sintomas o yung mga warning signs na kailangan bantayan sa breast cancer?
So, mga warning signs usually, di ba, may mga bukol na nakakapan sa isang breast or minsan naman, although remember that hindi lahat ng bukol sa breast are cancer, you know? It can be benign. So, but if there one, usually magpasuri na kayo and then usually abnormal ng paglaki and then minsan nagkakaroon sila ng sugat mismo sa skin na and then nagkakaroon ng mga discharge sa nipples, no? Or even, usually ang mga breast mass hindi painful, but it can be painful once lumalaki na siya kasi kung nakakaipit na siya ibang mga organs. Yeah.
Okay. So, Doc, yun yung mga dapat abangan ng ating mga kababaihan ngayon, no? Minsan kasi nakakalimutan natin to check, pero I know there is a proper way to do that, no? Eto, Doc, paano nga ba dapat chine-check kung may bukol o lump sa inyong mga dibdib?
Okay. So, usually, para hindi kayo malito, we advise na you get a day. For example, today is this October 14.
15 ata.
15. So, November 15, December 15, ugaliin nyo mag-check ng ganon daily. Wag nyo siyang ipalit-palit yung petsa. Kasi sometimes, especially pag female, minsan kasi, pag nagkaka-menstruation, minsan nagkakaroon ng na-enlarge yung breast, namamaga. So, minsan nalilito kayo. So, just pick a day and every day, every month, mag-check kayo. And what you do is, you raise your hand on both sides or one side and then look at the mirror. And then you can palpate, no? You can kapay mo from the center, from the nipple area, going out hanggang sa kilikili.
Okay.
In a circular matter, no? Palabas ng palabas. And then you do it, repeat again to the other side.
Okay.
Ganun lang gagawin mo. And then if you feel something, you can actually now go to your husband or your friend na babae to see kung may nakakapanga. And then, if there is one, they can seek consult na from a doctor.
Doc, pag-usapan naman natin yung mga risk factors. Ano nga ba yung mga risk factors ng breast cancer? At saka, totoo ba yung mga sabi-sabi online? Kasi maraming kumakalat, Doc, eh. Parang kapag nagsuot ka daw ng bra na nakatulugan mo,
mga ganyan.
o kaya gumamit ka na antiperspirants, o kaya mga breast implants. Totoo ba yung mga yun? Doc?
Okay, let's start with the myth, no? Yung mga myth yan, mga tight breasts, mga sports bra, no, you don't. Walang ganun, no? Walang mga constant pressure, walang ganung klaseng risk factors or your mga antiperspirant, no? There's no such thing as that. But those who have talagang documented na talaga na risk factors are one, you have early menstruation because pag nagkaka-early menstruation siya, nagkakaroon ka ng estrogen yun. No? Magproduce yung isang babae kasi may estrogen. So yung estrogen is a food for the cancer, for the breast cancer. So if you have early menstruation, or late mag-menopause. And then you have, for example, obesity because sa fat, nangyayari doon, nagpo-produce ng estrogen yan. So actually, again, estrogen is a food for tumors, for breast cancer to grow. So yun yung yun yung kanyang parang pagkain, you might say, no, fuel. So you have that, and then you have alcohol, yung pag-inom ng alcohol. So alcohol actually is not per se the problem. What happens is nagka-convert into fat. So, nagiging fat din siya. And then, yung mga sedentary lifestyle, hindi nag-exercise. So, those who are being obese, hindi lang siya for risk for heart diseases, diabetes, but can also lead to cancers, not just breast cancer, and other cancers as well.
Very important talaga. Yung lifestyle talaga, nakaka-affect din talaga siya. Ito naman, Doc, akala kasi ng marami, babae lang ang posibleng magkaroon ng breast cancer. May chance rin ba, Doc, na pwedeng magkaroon yung mga lalaki?
So, in all breast cancer, there is 1% chance for a male to develop breast cancer. Yes, there is a chance for ang lalaki magkaroon ng breast cancer. So it's like 1.2 to at 100,000 na male that can have a risk factor. And then the risk factors are usually the same as the female, obesity din, but usually it's genetically linked, may mga genetically linked din. Oh, well, sa female din, of course, meron din mga risk factors as yung first-degree relatives who have breast cancers or ovarian cancers, who have BRCA mutations, who are at risk to develop breast cancer.
Doc, ito singit ko lang tong question na to. Is there, meron bang factor na we are of Filipino descent, of American descent? May ganun ba?
Yes,
Mas,
so yeah. So usually may yung mga Hudyo, mga Jews, they are high risk, no? Because of the lineage nila na because of siguro the Holocaust before, yung radiation, so nagkaroon na sila ng parang genetic mutations. But in Asians, wala masyado. If you compute, merong kino-compute siya na Gale model. So if you compute for that model, Asian has a mas lower ang risk. Asian per se. But remember, there are other risk factors nga, like for example, yung alcohol, early menarche, early menstruation, late menopause. So those are factors that you have to put all in.
Pwede ring trigger.
Add on siya compiling siya. We can actually compute that, and then if you have a high risk, then we ask them to have early screening pa.
That's right. Doc, ito, ano ba yung mga practical tips na lang muna para sa mga kapatid natin na wala naman silang breast cancer at the moment at gusto nilang maiwasan ito and they wanna make a lifestyle change? Anong mga pwede nating ibigay sa kanilang tips?
So again, diet, basically eat moderately, wag sobra-sobra. And then exercise is really important, not just for the breast cancer prevention, but as well as your general well-being. So at least 30 minutes a day, if you can. And then of course, for breast cancer per se, early screening po. At the age of 40 years old, we advise them to do screening talaga.
Ito pa yung
mammogram. Yeah.
Mammogram.
Yeah, mammogram.
Doc, kunwari, pag sa ganito, gusto ko lang malaman, for example, meron bang superfood na pwedeng i-take or kainin or na dito sa Pilipinas mahanap natin na cancer preventing, ika nga. Hindi naman to cure, but to prevent. May ganun ba?
Maraming kasing lumalabas na mga ganyan na nagpa-promote ng mga superfood, diba? Remember, those are being studied naman. Wala talagang
no therapeutical.
Yes, they're therapeutic claims, diba? So in a sense, what we advise talaga is a well-balanced meal. So you actually, even the vitamins, when you do vitamins, because kung kulang kinakain mo, that's why you take vitamins. But if you have the proper food, you have the balanced meal.
No need even for vitamins.
Yes, exactly.
That's amazing. Okay. Ang dami kong natutunan sa iyo ngayon, Doc Arthur. Maraming salamat. And I'm sure na-appreciate na lahat ng mga kapatid nating nanonood ngayon, lalo na that we are celebrating it this October. Again, maraming salamat, Dr. Arthur. Thank you. And Doc Richard Gadiaza, of course, maraming salamat. Mga kapatid, Dimples Romana po, maging maalam at may pakialam sa mga napapanahong issue at headlines. Mag-follow na po at subscribe na sa social media pages ng News 5.